The meeting to order, and we are here to study the ongoing study on ensuring that Canada's immigration system is secure. And today we have two segments, and during the first segment we'll have Benjamin Muller, Professor of Political Science from King's University, followed by Dr. Mark Tyndall, Professor and Head Division of Infectious Diseases at the University of Ottawa. You will both have 10 minutes to speak each, and then we will have a series of questions. And I want to remind everybody that this is televised, just so that everyone is aware. Yes, Mr. Dykstra. Deputy Dykstra.
I have a couple of questions. Specifically to you, Chair, and it has to do with both of the individuals here were called, as I understand, were your witnesses. These are witnesses that you submitted to the clerk?
I believe.
Or it may have been Mr. Lamoureux? Both of them?
Yes, I believe they both are.
Okay. Then the setup is fine because my questions are about process and how we're going to handle this afternoon. I certainly, obviously, want to thank witnesses who come to committee to present on behalf of their perspective on the issues that we are dealing with. I do have a question for Mr. Lamoureux, and that is, well, Dr. Tyndale obviously has a great deal of background and research and understanding of issues pertaining to the health and the welfare of those in our communities. I'm not sure, and I'd like to make sure and get your specific understanding as to how his interests or his presentation are going to relate to the study of the security of our borders here in Canada.
Mr. Lamoureux?
Thank you, Madam Chair. And I do find it a little bit surprising. You know, last Monday we were sitting here, and we had a presenter, and I believe it was a Conservative possible presenter that came forward and made his presentation based on multiculturalism. And it was, I thought, fairly well received in terms of members. You know, I would suggest to you that this particular witness that you're referring to has a great deal of background knowledge, and there are many refugees that come to Canada that might have issues surrounding health. And I think that it is appropriate, and would suggest that we just continue on, listen to the presentations, and then go forward from there.
Well, I want, through you, Chair, I want to be fair to Dr. Tyndale. I don't have an issue with him presenting here today, but as you know, we do have we did lay out as a committee, as a subcommittee, which was later verified and agreed to by the committee, that we would be specific around the security issues relating to immigration. And if you recall, this is one of the suggestions you made, to have this study based on your readings of the Auditor General's report. So if Dr. Tyndale is here today to speak to the issues of security and as they relate to the refugees and the perspective that he has on that issue, I obviously have no problem with that whatsoever. I just want to make sure that, in fact, it does relate to security of those who are in this country and those who want to come to this country.
As Chair, I just want to say that areas of study that are included, just so we are all aware, because I know it's been a while since we reviewed those, is biometrics, war criminals, security clearance, checks, border security, visas, detention and removal. And just so that everybody is aware.
So if his presentation is pertaining to those issues, and I would like to hear what both Mr. Mueller and Dr. Tyndale have to say this afternoon.
Madam Chair, I do appreciate the comments from the Minister, and I do appreciate your comments also as Chair, but I think it's important that we recognize that all political parties have the opportunity to invite guests. We are talking, and you cannot tell me that the health and well-being of refugees is not relevant to this particular committee. There are many refugees that come into our country that are in need of health care services. I don't want to put in any way and tell a witness what he can or cannot present. I'm sure that he would have been made aware of what the committee is actually dealing with. I'm not going to censor his comments. I think we should just continue on. It's 10 minutes presentation. I didn't, on a point of order or anything of that nature, when we had a witness here on Monday that just talked about multiculturalism. And I didn't raise and say, well, on a point of order, let's be relevant and then dictate exactly what the chair just finished dictating. In fact, if we adhered or forced every presenter to adhere to what the chair just dictated, I suspect that there would have been numerous points of order. So I don't think Mr. Tyndall should be signaled out in any fashion whatsoever. He should be allowed to make his presentation. And if you don't believe it's relevant and it's important to ask questions, I'll be more than happy to take the Conservatives' questions. We have two witnesses that are here. You don't even have to ask your questions to that particular witness. So I would suggest that it is in order, and we just continue on.
Just as chair, if I misspoke and I wasn't clear about what I was trying to show that there is an overarching. It's not just a very narrow definition of who appears as witnesses. At no time was I trying to narrow the field, and I, from the chair's perspective, do not see an issue with the witness because he is going to be talking about one aspect of security.
My intentions are not to do anything of the sort that Mr. Lamoureux is suggesting. I'm merely pointing out that we need to be fair to witnesses who come here, that when they're going to make presentations, if they aren't aware of or understand the reason for their presentation in terms of how it relates to the overarching security issue that we're studying here at committee, it puts them in an awkward position to be able to make a presentation. And it also puts me in an awkward position as PS and lead on this side to continually interrupt or to question whether or not the discussion that we're having is relevant to the study that we're working through. And rather than just be quiet and go through that process as he's presenting or as someone's asking questions, I thought it'd be a little more polite to lay it out before the actual presentation started, so he would be aware, and also that I could, in all fairness, relate to you my concern, and obviously you think it's not a problem, so I'm going to assume that it won't be.
Okay. I got a speakers list, and I want to stop this two-way dialogue, and important as it is, and you can maybe have that on your own later or get in line. So I do have two other speakers, and I'm going to go to Deputy Menegakis first.
Thank you, Madam Chair. If I could just add my voice to what Mr. Dykstra is saying. I believe what Mr. Dykstra is saying is that we need to stick with the terms of reference as they relate to the study specifically that we're studying, which is security. If the witnesses, no matter who the witnesses are, who are kind enough to appear before us, are testifying in accordance with the terms of reference of the invitation here, I think that's what Mr. Dykstra was trying to bring up. We certainly have no problem.
Thank you.
Thank you, Madam Chair. I simply wanted to actually raise a point of order. I think it's important for us to be able to ask questions of witnesses. That being said, we all receive the witness list as members of the committee, and I think in all good conscience we personally invite our witnesses based on what needs to be addressed. I don't think there's been any big variance between the witnesses that have been called before this committee and the subject matter at hand. So this is a point of order so as to go and expedite this process. Thank you.
Deputy Lamoureux.
Thank you, Madam Chair. I just want to emphasize a couple of points. One is that when we ask for witnesses to come before the committee, that it's important to recognize you have 12 members of Parliament. You're sitting in a very formal room. That in itself can be somewhat intimidating to some witnesses, and I'm not suggesting that Mr. Tyndale or other witnesses are intimidated per se by it, but it's something that we should at least be aware of. And if we were to start every meeting where we dictated in terms of here is what we expect you to be providing comment on, I don't believe that that is in fact appropriate. If you have an individual or there's a government policy that has been made which in essence takes away health care services, for example, from refugees, does that have any sort of a risk factor? I would suggest to you that it could play a risk factor. I don't want to tell a presenter what he or she can or cannot present. We are affording the people the opportunity to present before this committee on what they believe is important to them in relation to immigration and citizenship. And in this particular case, we're studying, as it's been pointed out, a detailed report that we're hoping to be able to provide recommendations to the minister. And I believe at the end of the day, if we believe that there is a need to have a recommendation that says that by reinstating health care services or anything of that nature will ultimately be better and improve the security of Canada, if you have someone here that's denied the opportunity, for example, to be able to get some sort of medical treatment and they end up falling on the other side of the law as a direct result of that, I think that that is something that is worthy of being able to talk about. So, I'll leave it at that. I would hope.
I'm going to take the point of order, and I just want to say that I think I've heard a fair bit of debate. I'm going to take the point of order, then I'm going to make a ruling. Point of order?
My point of order is that I think that we really need to go in camera on this. My colleague across the way, Mr. Lamoureux, was talking about policies that we're not discussing in this particular session of our Committee on Security, and I think that if he needs to air that, it does not need to be done in front of our two witnesses that are here for their time to speak to this committee. So I'm going to put a motion forward that we go in camera to allow Mr. Lamoureux to continue talking about the other issues that he has. Thank you.
I'm just trying to seek some guidance because in the world I've lived in, I didn't know a point of order could lead to a motion to go into committee.
She would get the floor had she not said a point of order again.
Is there any time?
On the same point of order, Madam Chair, just to facilitate what Ms. James is trying to do.
Mr. Lamoureux, I've got to first, I'm trying to think through the
sure.
rules
I'm just
of
trying
order
to help
here.
on the same point of order, if I can provide comment on it. I believe if you check with the clerk, I can do that.
It's non-debatable, so no comment.
A point of order is debatable. I believe the floor was recognized as a point of order, so I should be able to address the point of order.
She moved a point of order, but then she actually moved a motion, and we're now dealing with the motion.
A person does not move a point of order. You stand on a point of order, and after the point of order is dealt with, then they can move a motion. All I was going to suggest...
Okay, just make your comment.
All I'm going to suggest is that I will conclude my comments, and maybe you can make a ruling on the point of order not being a point of order, and then Ms. James can move her motion.
I'm going to go back to Deputy James.
Thank you.
Just motion.
I actually wanted to go in camera, but at this point in time, I would really like to hear from the witnesses, as opposed to my colleague talking about a bunch of other things that may have come before committee before or that may be dealt with elsewhere, not in this particular session that we're studying.
Thank you very much.
So I prefer that we just move ahead with this particular witness.
So that's what we're going to be doing right now. We're going to be moving on with hearing from the witnesses. You both have 10 minutes each. And we will start off with Benjamin Muller.
All right. Thank you for having me. I appreciate it. Throughout the world, biometric technologies are used in border security to varying degrees. A panoply of machine-readable travel documents are increasingly prevalent, particularly among so-called trusted or registered traveler programs, as well as in permanent resident, green card, and visa schemes. Even in these cases, serious questions regarding the continued potential insecurity of breeder documents tend to be ignored, and the dangerous consequences of social sorting are deliberately avoided. Social sorting refers to the manner in which increasing amounts of digital information on individuals begin to create a so-called data double, which, although desirable to marketers and law enforcement, has shown to be less effective in predicting risk and more effective in predicting your next purchase on Amazon. Still, some jurisdictions have taken biometrics to a much higher level, such as the development at the University of Arizona of Avatar, the automated virtual agent for truth assessment in real time, which is effectively something the size of an ATM machine and replaces a border agent using artificial intelligence and biometrics to carry out typical initial inspection. In all these cases, there are significant questions which remain unanswered and relatively unexplored about biometrics. Using these technologies, as well as various other forms of surveillance, have significant problems in terms of public buy-in. Certainly part of the problem is the lack of public participation in the process and the adoption of these technologies. It is often unclear why particular biometric technologies are adopted, what makes a specific biometric technology apt for a specific problem. Like many tools, they simply oversimplify complex political, social, and legal networks according to a new classification of biometrically enrolled subjects. There is what Joseph Pugliese refers to as infrastructural diffusion, where certain norms of gender, ethnicity, and socioeconomic status are bred into the technologies themselves. And a prime example would be the failure of facial recognition biometrics on African Americans tested at Miami-Dade Airport. The development and application of biometric technologies tends not to focus simply on helping to resolve with greater certainty who you are, but with increasing interconnection with other pieces of personal digital data determines what you are. Are we aware and comfortable with the way in which this transforms our manage of the border and the mobile subjects who intend to cross it? Beyond deeply important ethical, political, and social issues, there are straightforward problems with biometric technologies that deserve consideration. A recent study at the University of Notre Dame, published in Nature magazine, found that the so-called false match rate increased 153% over 3 years. A 5-year study released in September by the National Research Council in Washington, D.C., labeled biometrics as inherently fallible. They only provide probabilistic results and not yes and no answers. We are in dire need of increased research on the biological underpinnings of human distinctiveness, how stable the actual physiological characteristics that the technology is designed to measure remains in serious question. The Avatar program, which is now being tested along the Arizona-Mexico border, biometrically measures 15 of 500 possible cues, which is lower than the 5% threshold set by the developers themselves. Happily for them, politicians are more excited about the gadgets than reflecting on the science they themselves have laid out. There are some important questions we need to ask. What precisely do we expect these technologies to solve? What are the specific problems we believe they will address? Is the government willing to invest in public and intellectual engagement to consider seriously the specific efficacy, efficiency, and inherent problems associated with the use of these technologies? The research demonstrates that the industry is not compelled to do so on its own. 3 brief conclusions. The signing of the Beyond the Border Agreement already puts into policy what Nick Vaughan Williams has referred to as the border not being where it is supposed to be. It is clear that this agreement will compel Canada to engage on a variety of bilateral fronts on the management and enforcement of mobility and circulation, but the extent to which this has occurred with little significant public consultation and to what extent it requires the total adoption of these specific biometric technologies may still be something that is salvageable. 2, the increased reliance on biometric technologies together with other forms of digital surveillance move us away from a question of who the person is to what kind of person this is. This significantly alters how the border operates. And 3, the United States and Europe have multiple, skilled, and effective independent and non-governmental institutions devoted to evaluating border security, the practices, strategies, and technologies to be applied therein. Canada has none. The absence of this capacity will do little to enable policy innovation, effectively evaluate the efficacy and efficiency of strategies to secure the border and enhance mobility, or move us away from being little more than reactive to the foreign innovations of other policies. Thank you.
Thank you very much. We'll move straight over to you, Dr. Tyndall.
Okay. Thank you very much. First off, I'd like to thank the committee for the invitation, and it's a new experience to me, and building up to my talk, that's another new experience, so it's thank you for that. As a bit of background, I'm a physician at the Ottawa Hospital with expertise in public health and HIV. I completed my medical school in internal medicine specialty training at McMaster University, followed by a fellowship in infectious diseases at the University of Manitoba. I went to the Harvard School of Public Health and completed a doctoral degree in epidemiology, and through these trainings I spent about 4 years working in Kenya doing HIV research. I took a job at the University of British Columbia in 1999 and spent about 11 years looking at HIV prevention strategies among marginalized populations, including drug users and refugees. I moved to the University of Ottawa in 2010 to become the head of infectious diseases with my goal to expand the public health mandate of the division. The clinic that I'm in charge of in the Ottawa Hospital has a large refugee caseload. As would be expected at an infectious disease clinic, we deal with infections. The biggest threats to refugee health, at least on arrival to Canada, are infections, most notably HIV and tuberculosis. On April 25th, when Minister Kenney announced the cutbacks to federal health funding, the clinic physicians were in shock. Currently, every major healthcare organization has spoken out in opposition and rallies against these cuts across Canada. Although the government has remained steadfast in its public announcements around the cuts, there has been a number of changes and rollbacks that have just added to the confusion. We are now anticipating the list of designated countries of origin that will further limit access to health care for some refugee claimants. There are many reasons that these cuts to IFH are bad for refugees, bad for health care, and bad for Canada. However, today I will focus on public health and why limiting access to health care creates a real threat to our collective public health security. Of all the issues being considered by this committee, public health and the spread of disease should be recognized as a very serious threat to our security. It has been stated over and over by the Minister of Immigration and his staff that infectious diseases that are considered a threat to public health and safety will continue to be covered under the new IFH plans. However, for all their resilience and optimism, refugees are generally scared and uncertain about their immediate futures when they arrive in Canada. For many refugees, Western medicine is foreign and unproven. It is only in the hands of skilled healthcare workers over multiple visits that trust is built and medical recommendations can be followed. There is much more to treating HIV than providing pills. One of the biggest public health failures in confronting the global HIV epidemic has been a failure to appreciate the importance of providing a comprehensive set of health care supports for people who are HIV positive. In the United States, a study presented at the World AIDS Conference this summer showed that of the estimated 1 million people infected, only 75% knew they were HIV positive, only 50% were receiving HIV care, and only 28% were actually successfully taking their HIV medications. This is exactly what happens when people are not engaged in consistent health care. For the IFH program to continue to pay for the cost of HIV medications but fail to support the very care that makes successful treatment possible undermines the whole program. With these cuts, we are at risk of losing the patients that are currently engaged in comprehensive care and much less likely to engage new patients in HIV treatment. We currently have the tools and expertise to diagnose and treat communicable diseases and limit their spread. However, if the patients are driven away and disengaged from health care, there is no way to identify infections and provide the necessary care, treatment, and education. Tuberculosis is another serious threat to public health security in Canada. Unlike HIV that will usually be picked up through mandatory HIV testing prior to arrival in Canada, tuberculosis is often asymptomatic and very difficult to diagnose. In many developing countries, the actual infection is picked up during childhood and lies dormant. The only way to diagnose and treat tuberculosis is to have consistent clinical care and provide diagnostic testing at the first signs of cough, fever, or other more subtle symptoms. The continued provision of medications to treat tuberculosis through the IFH is a small part of the necessary tools for early detection and the prevention of spread to others. The cutbacks will have a dramatic impact on the ability for public health to protect Canadians from the spread of imported tuberculosis. There are certainly other threats to public health beyond HIV and tuberculosis. However, these examples serve to illustrate the very real threat to public health and security resulting from cuts to IFH. It is imperative that refugees are offered comprehensive health care to successfully integrate into Canadian society. IFH funding provides a critical safety net as refugee claimants await the decisions about whether they can stay in Canada or not. For communicable diseases, even a few weeks can be critical, and if the process drags on for years, which has been the case for a number of patients in our clinic, then the threat of spreading infectious diseases to others, both inside and outside their immediate community, is very real. It is very predictable that we will start to see people defaulting on their HIV treatment, presenting with advanced HIV, and women giving birth to HIV-positive babies. In addition, we will see people presenting to emergency departments with advanced tuberculosis, and there will be cases of tuberculosis transmitted within Canada from refugees. These are not far-fetched scenarios. In fact, they were happening before any cutbacks to IFH. I feel that the cuts to refugee health care are short-sighted and will directly erode the public health care system that we have in Canada. In my view, this has a direct impact to Canadian security. Thank you.
Thank you very much. And I'm going over to Deputy Menigakis.
Thank you, Madam Chair. And thank you to our witnesses for appearing before us today. I'm glad that we're getting this underway, and I apologize as I flip over. I had prepared a few questions that I'd like to ask today. We are studying security. There's a whole bunch of things that come with that, so I'm wondering if I can get your view on a few things. So in your opinion, with the electronic travel authorization, ETA as it is known, and the entry-exit provisions in the Pritter Agreement, prevent foreign criminals from abusing our generous immigration system? Mr. Muller.
I'm not aware of any data that would demonstrate that.
Are you familiar with the ETA at all?
Yes. I'm also familiar with the extent to which, when it comes to border security, for example, unless you have catastrophic failure, you tend not to be aware of whether something is effective or not. So, for example, if someone crosses the border, comes into the country, leaves again, and actually doesn't do anything, we have no way of knowing if, in fact, that individual was a risky individual. Just because they chose not to act, we're unaware, and we may falsely put that down as effectiveness.
Oh, so if you're familiar with ETA, then you are aware that the ETA will allow the government to be able to know every time a single person enters or exits between Canada and the U.S., even at land crossing.
Yes, I'm aware of that. The other issue is...
Would that information not be useful?
Sure. In terms of profiling, the unfortunate thing is, up until this point, in most cases, profiling does not appear to be terribly effective. It certainly hasn't effectively stopped people such as Richard Reed, the Antwerp bomber, these sorts of individuals. The other point I would make is that the recent studies specifically on biometrics suggest that one of the problems is over time the biometric can become highly unreliable. So in terms of repeat movement over a time period, that's a problem.
It's actually my next question, but just before I get to that, I want to stick with the ETA for a moment. Do you think it will help the government crack down on residency fraud and people wanting Canadian status without living here or paying into the system?
Possibly. Yeah, I think, if anything, that would be a potential site where it might be effective.
Okay.
Yeah.
Okay, on biometrics, the impetus behind the biometrics, the reason why we are considering implementing it, is because it has been identified by law enforcement agencies that have testified before us as a 21st century identification tool. And I'm referring specifically to the RCMP, to the CBSA, to CSIS, they feel that that type of information will be very useful in identifying someone, particularly in cases where someone has 5 or 6 or 7 names in their name. They've been refused a number of times because they were deemed to be a risk to the country, and they come back with a different derivation, if you will, of their names. Do you think that's an effective tool for preventing fraud and keep security threats out of the country?
Not as effective as, should we say, human intelligence. My research has not indicated that there's any reason we ought to simply be jumping on board the use of biometrics. I'm well aware that law enforcement agencies tend to be reasonably happy with it until you get to the sort of high point of it, which I would say what the Avatar program that the University of Arizona has come up with, because then it actually starts taking their jobs away. And so you clearly, obviously, have labor issues at that point. But in terms of gathering information, sure, it's good to gather information. What you do with that, how interoperable those bits of information are, I think there's obviously privacy questions as well as reliability. For the most part, I feel that these biometric technologies are relatively understudied. That's why we're only now getting some of the longer-term studies, which are what are useful. At the moment, most of the research we get are from the manufacturers themselves. And I don't think I need to tell everyone that there could be problems with that.
Certainly the manufacturers and biometrics have been tested by law enforcement agencies before they recommend them. But let's talk from a practical perspective. You speak about human intelligence being an alternative. Someone shows up at our border today, right now, as we speak, and they say, I want to come into your country. There's an officer there who is looking and interviewing you as you're going through this process. He doesn't know who you are. You could tell him anything. With a biometric, he can look you up in the computer with your picture, possibly your iris scan, and your fingerprint, and he'll know exactly who you are. Would that not be a useful tool for that intelligence officer? It's not a question of coming in without having a human interaction anyways. No one is talking and someone's going to walk to the border, walk in a booth, and the door will open and they'll get into Canada. There will be a person there that's going to be using that as a tool. That's what the law enforcement people that presented before us testified. It's an additional tool that they can use to help them in the identification of the individual. And the whole point of this is to ensure that we know the identity of an individual before they walk our streets, shop with our families, be around our kids. We need to know who they are. And that is why, the main thing that they kept bringing up to us. You don't think that that can be a useful tool for an intelligence officer at the airport, or a CBSA agent or someone at the border to have in discussing or in deciding whether or not they're going to allow someone in the country?
If we assume that the technology can't be defrauded, I would agree with you. But there's increasing research that suggests one can basically mess with biometric readings, that high-resolution photographs, for example, will get you past facial recognition technologies in some cases. Fingerprinting is actually one of the easier ones. Of course, it happens to be a cheaper one as well, so it's more prevalent.
Well, isn't it a little bit more secure than someone just making a judgment on what you're telling them?
Well, a judgment has been made when that biometric...
no, I'm talking
10 seconds left there.
In addition to...
Yeah, I mean...
7 minutes, right?
But to assume that those judgments are somehow not made with the use of biometrics, they still are. I think there's a sort of misapplied faith in this sense to the technology.
All right, thank you very much. My time's up.
Go to Ms. Sims, 7 minutes.
Thank you very much. And I'm going to direct my first couple of questions towards Dr. Tyndall. And I want to thank you, both of you, for coming to make the presentation. And I appreciated the presentation you made about public health. And there isn't a greater area of security for me than public health, because that's one that has no boundaries. And so thank you for your presentation. And often, when we sit around, when we think about security, we only think it means what happens at the border, and it's about deportation. But we know that security works both ways, and that we must ensure the safety and security for newcomers, especially vulnerable refugees. And health itself can also, and security of health is very, very critical. Now, you've had first-hand experience, Dr. Tyndall, with treating refugees at the hospital. So I'm interested in how the cuts to the interim federal health program for refugees are impacting their security. Last week, Doctors for Refugee Health released a report that said, 3 months after dramatic cuts to federally funded refugee healthcare services took effect, the program that manages these services is marred by confusion, unnecessary costs, and compromised care. The report goes on to detail dozens of cases and says pregnant women and children are being particularly affected by the cuts. So, in one particularly shocking example from the study, a young female refugee claimant is 18 weeks pregnant as a result of a sexual assault while being used as a sexual slave. She has no IFH coverage to address the pregnancy. Can you share with the committee any cases you are aware of and how the cuts are affecting the refugees you see?
Sure. Thank you very much. The report that was submitted last week showed a number of cases. In Ottawa itself, there's probably 50 people in the clinic with some IFH coverage. A lot of people that we see are getting treated for tuberculosis and HIV, and as I mentioned, that was the treatment of those two infections are still protected, and people still get their pills. Most of the people then have already had a relationship with us, and they continue to get their pills. What is problematic now, however, is other services that they need. So they come to a clinic with hypertension, for instance, or some have diabetes, and they're running into difficulties getting these medications covered, and they have no fallback. So there are cases of people that we're still following for their HIV, but they no longer get coverage for their other medications that, in some respects, have everything to do with their HIV infection. So just picking out just the pills for their HIV is not enough.
Dr. Tyndall, I just have a point of order from Ms. James.
Thank you, and I believe this is a point of order. We talked at the front that we're studying border security, and I listened very intently to Ms. CIMM's questions, and nowhere did I hear questions such as how can we prevent people from coming into the country who have communicable diseases, as opposed to just case studies or examples of someone that's already here and that may have been asked to leave. So I just want to redirect the committee back to our original focus of this study, which is on border security, and I would just hope that future questions will be dealt with in that particular stream. Thank you.
Okay. In regards to it being a point of order, Ms. James, I think that the committee has demonstrated, and we could probably cite back to the last time we met in terms of the types of questions and answers that were being given. I believe that this is, in comparison, just as relevant, but I appreciate the sensitivity on the issue, so I'll say it's not a point of order. I'll let Dr. Tyndall to continue, and hopefully we can get through the process.
I can also comment on, as you were asking, what happens to new patients coming, and doctors cannot be put in a position to be the border guards. So people get to the clinic and seek medical attention far after all these safeguards have been put in place. So I think part of our concern is that some of our tools are taken away from us through these cutbacks. So people who come really need health care, and some of that health care can be very important to the community at large. They will not be able to access that anymore. And as doctors, the program right now is in such disarray that we're only told to call Blue Cross and find out if this particular diagnostic procedure or drug could possibly be covered for a specific person. Obviously, it takes hours to get that information back. The person's there. So currently, I think the project, as things change, it's a moving target. Most clinics now are in a very bad way when they see new patients come to them. And I have no control over who comes to the clinic. They have a problem, in my case, infectious disease problem, and I feel as a physician, it's my duty to provide them the best care that I can. And by saying that well, I have to check and see if I can provide you with any
Dr.
care
Tyndall.
is difficult.
Yeah, thank you. I have very short time, so I did have another question for you. And thank you for focusing in on infectious diseases, which definitely has a lot to do with our overall security. A particularly troubling aspect of these changes, the ones that have been made recently, is that potentially legitimate refugees from so-called safe countries under the recently passed legislation C-31 will be cut off from even basic medical coverage. Eventually we will learn who these so-called safe countries are, but we don't know yet. Can you talk about how the cuts affect these particular refugee claimants, especially when it comes to infectious diseases and overall security?
My understanding is that some of those class will receive no health care whatsoever. So from a public health point of view, I think that's a disaster. So people do have infectious diseases that they need to be treated for to protect our public health system. And if they're denied any care at all, it's really a problem for our own security and our public health system.
Sorry. I thought my time was up.
Minute and 8 seconds.
Sorry, how much?
Minute and 8.
Okay, thank you very much. Once again, I do want to thank you. And one of the things I've realized as we've looked at this, that we do have provinces like Manitoba, where they have said that they will actually be covering on an interim basis some of the people who are not covered right now. But I believe my colleague will be following up on that in more detail during the next round. Thank you. Okay, Deputy Lamoureux.
Thank you. Thank you, Madam Chair. I do appreciate both presenters and your comments. I want to go to Dr. Tyndall in regards to individuals that come as refugees to our country. Do we have a sense in terms of a percentage, or can give us any indication as to how many that would be coming as refugees that would have some sort of a medical condition? Can you provide comment on that?
Well, everybody who comes is entitled to a first examination where a lot of things are screened, and I would say that infectious diseases in this population is high. So people have come from very bad situations. So I don't have the numbers in the top of my head, but I would think that well over 50% of people who are screened need some kind of diagnostic procedure or medical intervention, including treatment. So quite a high proportion of people. One
of the diseases you refer to is tuberculosis. I have a tough time with that particular word. That is something that is not identified right away. It takes time to identify that, so there's follow-up that's required? I think tuberculosis is the best example where these cutbacks will have the most impact. So if we're telling people that their access to health care and treatment and diagnostics is limited, they won't come to a doctor. So most people that come from developing countries were exposed to TB in early life, and the disease comes up at no predictable time. So a lot of people will present to their family doctor and say they haven't been feeling well for a few days, they have a cough or fever, and that needs to trigger an X-ray and further diagnostic tests. So unless there's ongoing follow-up, we're bound to miss or certainly have a delay in our ability to recognize tuberculosis. And that's already a big problem in Canada. So people, especially First Nations people, have very high rates of TB. So we do our best to screen people, but the TB is one thing that can really get out of hand if we don't have ongoing comprehensive care from people coming from endemic countries. So the spread of disease is a security issue when individuals are coming into Canada, and quite often it takes a while in order for us to determine whether or not someone is infected. So your suggestion is that we need to continue on providing those medical services because it's in the public's best interest that we do so.
definitely in the public's best interest, and from many aspects, even many chronic diseases that we know, we have great evidence that preemptively dealing with these saves us a lot of money and problems in the long term. So denying people basic medications for their diabetes and hypertension and asthma from a public health point of view makes no sense. And if we're talking about infectious diseases, waiting till people present to the emergency room with their active tuberculosis, there's a very good chance they've already exposed many other people. And this is not something that they may have just infected their family members. This is the kind of infection that can be transmitted in shopping malls and bowling alleys or wherever people may end up going. So it becomes very difficult to find people before they've already transmitted to others.
Thank you. Thank you.
You still have a minute and a half.
Mr. Mueller, I wanted to just do a follow-up in terms of biometrics. It is something in which we're hearing a lot about coming from the government and other stakeholders, that this seems to be an answer to many of the issues related to security. I'm wondering if you can give an indication in terms of like live biometrics. It includes fingerprints, a live picture, from what I understand. Can you just provide comment in terms of to what degree do you think Canadians should take comfort in biometrics as providing security?
I don't think any technology in and of itself provides security. It's the way in which it's used. And in the case of biometrics, I've studied the use of it in border security for about a decade now, and there simply is not sufficient data to demonstrate that when in fact it is used, that it provides increased security. And one of the problems is there is not a clear quote-unquote problem that is being introduced to deal with. The U.S. visit system, for example, there's no clear evidence that the United States is necessarily more secure as a result of that system. It simply is not there. The flow of migration, particularly at its southern border, continues with that, with the use of Avatar now. Those things continue. Yes, you can create more profiling, but the extent to which that is in fact useful, I think, is not clear. There's not evidence.
Do you find there's conventions?
Okay, you're done. Deputy Opitz.
Yeah, I'm going to give Mr. Dykstra a first moment or two.
Thanks. I just want to clarify a comment or question that you asked Ms. Sims that is actually incorrect in terms of your assumption, and that is the refugees who come on, whether it's one of these infrequent arrivals, and you're saying that they would not receive interim federal health, they would in fact receive interim federal health from the federal government. So you asked Dr. Tyndale to respond to a question, which he rightly did, but the basis upon which you made your assumption is actually incorrect. So I think the record needs to be clear that interim federal health is available to those who apply for refugee status here in Canada, especially when we have an arrival like we did with the Sun Sea or the Ocean Lady. That still falls into place. The level of health care that they receive is different than the level it was prior to the changes that we've made, but indeed they still receive interim federal health.
My understanding is that if an irregular arrival arriving from a safe country, that you do not receive any interim federal health care benefits until you have been accepted as a refugee.
Well, I'm not sure that we've ever had a irregular arrival from a safe country, but if that were the case, in fact, they would receive until they've had their determination. Anyway.
Okay.
I can provide some if you like on that issue.
It's okay.
That's okay, because it's chewing up the rest of my time.
No, in fact, it shouldn't have chewed all of it up, because my statement might have, but not the response.
Going over to you.
Thank you. Mr. Mueller, what kind of, you're referring to the research you do. Is it academic research, or have you done field research on biometrics?
I have gone to Arizona to witness the use of the Avatar program in Nogales, Arizona. It's a city that's actually cut in half by the U.S.-Mexico border. And I've also spoken to both American and Canadian border agents who basically about the use of biometric technologies. But I'm not a scientist, I'm a social scientist.
Okay.
So.
But that machine you referenced is in trial stages right now. It's not,
It's been in
not
trial
deployed.
stages for, well, it is now being used in that instance. It has been trialed in Europe for 2 years already.
Well, what about a rollout? Is it rolled out? Or it's still in trial?
Well, it's being used in the Sentry system right now. So the interview that you do for Sentry, the U.S.-Mexico equivalent to the Nexus program, is currently being done in that location by the machine.
Okay. Do you have a Nexus card, by the way?
I do.
And how do you find it's working?
I actually got it as a part of research that I did in 2008 at the Border Policy Research Institute in Washington State.
Yeah, because I have one as well, and I find it worked quite well, and it's biometric. They take the eye scan, take your fingerprints, take a photograph. So they do understand who it is coming and going through that particular system. So I would suggest to you, sir, that that is relatively reliable overall and does provide a certain convenience of travel for travelers and others. But you also referred to, because I'm very short on time, how long do I have, Madam Chair?
You have another 3 minutes.
Oh, okay, good. You also referred to human intelligence and as an option to biometrics or an augment. So how is human intelligence gathered in this case, or human, as it's often called?
I guess I'd say 2 things. First of all, on your Nexus point, yes, it's convenient. It also doesn't prevent fraud. In fact, some suggestion is that it, in fact, can enhance it. Because the breeder documents required to get to Nexus are no more secure. The document you then receive on the basis of potentially fraudulent documents is then assumed to be more secure, and we then operate according to that assumption.
Yeah, but you're not just given this, just based on that alone. You're still getting an interview from both sets, Canadian and U.S.
Yeah.
So to your point, there is a human being also making a determination. So, but let's leave that alone. Let's go to human intelligence. How is human intelligence gathered, in your view, for use in immigration and border crossing?
I think for me the issue is and even in the case of Nexus, once you have the card, your human interaction decreases.
No, that's not gathering human intelligence. How do you gather human intelligence?
By talking to people.
Right.
And I think that assuming that a technology is going to take that place, and then making assumptions that these individuals who now carry a card or have participated in a program are more secure on the basis of the fact that they've put their fingers and retinas up for digitization, I think is that there's simply not data to support that in fact enhances security.
Yeah, but that's not entirely human intelligence. Human intelligence is gathered, for example, if you're looking at criminal groups trying to infiltrate a particular country, human intelligence is gathered through the discussion of groups in those countries. You can get that information through refugees. You can get that information through travelers and others. And it's a compilation of intelligence that's built up. Talking to an individual across a kiosk is not human intelligence, sir.
Right, but these programs that are being suggested are based on a variety of interoperable biometric data, then creating a profile of an individual based on their movement according to your entry and exit and so on. So there is an extent to which that is going to take the place of what you've just suggested.
Yeah, and I think we can all agree that nothing is 100% infallible, for sure. But I think biometrics will allow an ability for our country and others with shared data use and shared intelligence, human and otherwise, with other countries in protecting our country. So I think these biometrics, even if it's a 90% solution or 97% solution, is valid in making sure or helping to make sure that people who have infiltrated our country in the past and have been deported for criminal acts don't get back in. Would you agree that that's a valuable tool in terms of biometrics and being able to protect our security and our families, as Mr. Minigakis referred to earlier?
I'd agree that it's potentially a valuable tool, but statistics like 97% and so on, I'm simply, that's not what data demonstrates.
Well, but see, the thing is, you didn't provide any data today. You're saying studies show this and studies show that.
I listed 2 studies, recent studies, one by the University of Notre Dame and the other was by the National Science Council in Washington, D.C., both of which showing issues false positives in the neighborhood of 150%.
Just to let our guests know, I don't mean to be rude, but we do have very specific time allocations for each MP, and we want to make sure that every MP gets their turn. Just so that the committee is aware, as a result of us starting a little bit late with this, the clerk and I did split the time between the time difference so that both segments today would be of equal timing. Okay, so I would now like to go over to Sadia.
Merci, Madame la Présidente.
Thank you, Madam Chair. Thank you to our two witnesses for being here with us today. I have a question for Mr. Tyndall. You presented the IFH as a necessary protection for public health, that it would be a disaster to limit these health care services. We fully concur. Moreover, preventive health care is both humane, both more economical than otherwise. And it has been recognized internationally that everyone is entitled to enjoying better health, mentally and physically, and that the states have a responsibility for non-discrimination in respect of that right. What do you think of these provisions, and do you think they can be cast aside in the context of public health?
Thanks for the question. No, obviously, I don't. I think as this issue goes further and further, we've been careful not to push it to exclude any possibility that we can at least get the value back in what we had. So if there is a whole movement that everybody should be treated exactly the same, that health is a basic human right, and that this should be offered to everybody. And at this point in time, I think that the IFH as it was doesn't go to that extent, and so I think strategically, even if that's ultimately what I would support, as feeling very strongly that health is a human right, at this point the cutbacks have taken us so far away from that I think we're trying to battle at least to get some basic coverage back. So I think it reflects very badly on Canada if we deny health care to people. And I'm amazed at stories I read in the paper about animals being helped out. We would not deny health coverage to any Canadians. So, yeah.
1 second. Sorry, Mr. Dykstra.
I don't have any problem with anyone disagreeing at a certain point. That's the way democracy works. But Sadia's questions are going to relate to health care. Perhaps I feel, and as you, the chair, you could make the determination while the question's being asked. If it's relevant to security, then no problem. But if it's relevant to what the Health Committee should be studying, then I would submit that that's the time to interject and say, make sure it relates to the committee work that we're studying, and not something that could very well maybe a health may very well be a health care issue that could be debated at Health Committee, but certainly not from a security perspective. Did this have anything to do with the safety and security of our borders?
Let's go over to Deputy Lemarou.
It's just to the same point, Madam Chair, if the member was actually doing this through a point of order, I think what we have to do is, because I do believe that the presenter was actually very relevant to the actual question.
I'm not asking your opinion. I'm asking the chair's.
Well, and I'm advising.
I know
that
you and I have had this discussion already. I know what your opinion is.
So
you brought a motion forward that was defeated, actually.
Okay, the chair is just going to call for order from all sides, and if people could actually go through the chair, and I was asked by Deputy Dykstra to make a determination, and I am going to be doing that. And in the meantime, Deputy Lamoureux had a point of order or whatever, so he has a right to make his. And then I believe Sadia has a and then we will proceed. And then I will make a ruling after that.
Madam Chair, it's actually it's a very simple issue, and that was that I do believe that the presenter was relevant to the question, and if there is going to be an interruption, it should be after the question itself is asked. If the member had a difficult time with the question being out of order, that's one thing, but he was relevant to the question itself.
Thank you, Deputy Lemeru. Deputy Sadia, point of order?
Oui.
Yes, Madam Chair. I simply would like to point out that it is important that our witnesses be allowed to fully express their views when we ask them a question. Constantly interrupting them is not the role of members of Parliament in this committee. I just would like to remind members, Madam Chair, and I think it's important to reiterate this for the benefit of all members.
Thank you very much. Deputy Grogui has the time to ask her questions, and I'll go over to Dr. Tyndall to continue answering them. And everybody is aware that the questions all relate to security. Thank you.
I think that was pretty much finished.
Thank you. Sadia, you have another...
Oui, j'ai une autre question.
You have lots of time.
Absolument. Okay.
Absolutely. So my next question is for Mr. Muller. You refer to the limits of biometrics, of in fact the technology as a whole in the area of security. In one of your articles, you referred to fetishization of biometrics, and you conclude with 3 recommendations: do an overall critique of risk management, not treating technological measures as a panacea, and consult further with communities that are affected and stakeholders on how to administer borders. Are you still making these recommendations? Would you still be making these recommendations to our committee? And can you give us further details as to this?
Yes, thank you. Yes, I would stand behind those recommendations. The application of risk management and the way in which that has occurred is very much connected to the deployment of these technologies, and so I think examining that relationship is very important. As these sorts of experiences tend to endlessly confirm for me, there is a quick reaction to look at numbers that suggest somehow biometrics are good, full stop. There's very rarely specifics ever given in terms of a precise issue that it will in fact deal with at the border that is currently not dealt with sufficiently. And I think that's a significant issue. The other issue is, yes, the public in general, and particularly those who inhabit border communities, often tend not to be terribly favorable in terms of wanting the use of these technologies. In the Nexus case, sure, there's reasonable enrollment because of lifestyle, but studies have shown, and there's quite significant studies done on the Washington, B.C. border of this, that many people have chosen not to enroll in the Nexus program, stay in the lineups, simply for the fact that they have questions about the use of this technology and the way in which it can create the sort of data double issue where a variety of pieces of data are linked together to create a persona that may or may not be a reasonable approximation of you. And are we happy to make judgments on that basis? Not to mention that increasingly data is demonstrating these are not infallible technologies by any stretch of the imagination. When the designers of Avatar themselves say that their technology does not meet their own threshold, I think that's rather significant. But in that case, not significant to those willing to buy into it.
Yeah, you've got a minute and a half.
Okay. Nous avons eu...
Jeez, it's 5 minutes and your time is up.
Ah, déjà?
I just want to
Already.
up there for a second, and I thought you had 7 minutes. Earlier on, I heard a response about a study that you had to demonstrate the responses you were giving to Deputy Opitz. Is it possible for us to get that tabled to the committee so that we have that available for us to read?
Yeah, it's not a study I completed, but I can certainly submit that information
That
to
would
the
be
committee.
great.
Yeah.
Thank you very much.
Absolutely.
Yeah, thank you. Okay, we actually have 2 minutes. Mm-hmm. So what I'm going to suggest is we now take a 3-minute break, and then we will resume with the second part. I want to thank you both, Dr. Tyndall and Benjamin Muller, for the presentations you've made, and let me assure you we're not always this entertaining. Thank you. guest, please. Who is it, Dr. Wren, who's making the presentation? We have two speakers for this section. I don't know if both of you are speaking or only one of you.
I'm going to tee it up, and then my partner's going to take over.
Okay, so we have George Plattis and we have Donald Loren. Welcome, and you will both get 10 minutes to speak each.
Oh,
sorry.
We had arranged for 10 minutes combined, so.
Oh, 10 minutes combined is even better.
Yeah.
So you will get 10 minutes to speak, and then you will have a round of questions. Just so you know, it is televised.
Yes.
And if you need to use the device, they are right there in the table, and you may need them at one time or other. But you may be perfectly bilingual too, in which case you don't need them. So without further ado, we'll go over to you, George.
Thank you. To the Vice Chair and the members of the committee, we thank you for inviting us to appear before you once again. My name is George Platsis. I am a Program Director with the Center of Excellence in Security, Resilience, and Intelligence at the Schulich School of Business at York University in Toronto. With me today is one of our Center's senior distinguished faculty members, retired Rear Admiral Don Loren of the U.S. Navy. Please note that our comments are our own today, though, and do not reflect any of the organizations we may be associated with. The realities of the 21st century have shown us that technology has given access and ability to a larger number of actors, including small groups and individuals, all with differing intents and interests. The net result, even for a single actor, can have an asymmetric effect on society. Discussions focused on Canada's immigration policy, which are vast and broad, will define our ever-evolving Canadian identity, economic success, and security landscape. But for the purposes of this conversation and this session, we will focus on a very narrow range of issues specifically related to intelligence gathering capabilities and information handling, and this is both domestically between departments and internationally between our partners and our allies. Technology should be used as a tool, not as a crutch, and the foundation for any technology to protect our borders is intelligence. From information gathering to intelligence that is actionable, we need to ensure that the information we collect and analyze is kept confidential, maintains its integrity, and made available only to those who have legitimate use for it. This issue is daunting in an interagency and international context, especially as organizations use differing levels of internal security protocols. Consider that on the issue of admissibility, upwards of 10 or more Canadian departments and various statutes could apply. Depending on the case, we have IRPA, the Security Offences Act, the National Defence Act, the CSIS Act, and the Aeronautics Act, just to name a few, could apply. In this example that I just gave, CIC, the RCMP, CSIS, CSEC, CATSA would all have some jurisdictional responsibility, and we have even yet to consider our international possibilities. In addition, the creation of Shared Services Canada has been tasked to streamline over 100 email systems, 300 data centers, and over 3,000 overlapping and uncoordinated electronic networks. While this decision should reduce inefficiencies, there are other inherent risks that are associated to a fully integrated system. As we become more reliant on these systems to store personal information and make critical decisions, we also have a responsibility to harden these same systems, both from a technological perspective but also from a human use perspective. These same principles must also apply to more sensitive areas that fall outside the mandate and domain of Shared Services Canada, and these relate to our national security. There's a very simple concept that we must never forget. You are only as strong as your weakest link. Going forward, we must be able to assure the information we acquire and use. In an information sharing context, this requires both human and technological safeguards. Furthermore, our own ability, Canadian, to gather, validate, and protect information from our uniquely Canadian vantage point benefits Canadian interests and intents as we go forward so we can make our own assessments that meet our own needs. Ultimately, it should be sound information that acts as the basis for admission into Canada. We must be cognizant that given our systems and networks are interconnected, an information breach in one department may have an effect in many others, including the decision-making process for admissibility. It is at this point where I would like to invite a very great friend of Canada, Admiral Don Lauren, to share and give you the benefit of his experiences on these matters from an American and international perspective. Thank you.
Thank you, George. Madam Vice Chair, members of the committee, thank you for having me here again. I'm a great friend of Canada, and it is at my colleagues' request that I appear before you. Please note that all the comments made today are my own and not reflective of any organizations I may be affiliated with. As noted in my previous testimony before this committee, I am not here to address any laws in specific, as it is not my place as an American to do so. What I can offer is my perspective as the former Deputy Director for Operations Support at our National Counterterrorism Center, and as the former Deputy Assistant Secretary of Defense for Homeland Security Integration. I can offer my specific observations on issues of intelligence gathering, information sharing, and particularly within the interagency and international context. I can also give you a view as to assisting you to define your own unique Canadian interests as they may relate to immigration policies. The degree to which we can be proactive is the degree to which we both shall succeed or fail as we face the challenges that lay ahead for both our nations. Therefore, within that context, the challenges that both Canada and the United States face with respect to border security and immigration can only be resolved through both nations working together, as we have done in the air and missile defense of North America through NORAD. And the key to working together is to ensure that not only are the policies and programs implemented of both nations aligned, but that each nation is comfortable with the measures that are in place to address our customs and immigration challenges. In my professional experience, I can state that addressing these challenges is not only about ensuring the necessary equipment and resources are in place, but equally, if not more important, is ensuring the intelligence and law enforcement information upon which decisions are based is sound. For example, biometrics are often presented as a potential solution to solve many of the immigration issues we both experience. But it would be naive to believe that implementing expensive technical solutions without the necessary intelligence to inform the technology is the sole answer. Canada's membership of the Five Eyes provides access to significant amounts of information that can be used to better assess the potential risks posed by individuals attempting to enter the country. But this information must be readily available to appropriate decision makers and shared across agencies, something that both of our nations can do better. But even if the information was made available and utilized properly, there are secondary and tertiary concerns that must be addressed before courses of action are undertaken. For example, the security and assurance of the information must, of course, be protected. This means it is paramount that the infrastructure and architecture of the security and intelligence apparatuses used creates a level of confidence amongst Canadian allies in order to have a more open flow of information, as this information will ultimately help ensure only legitimate persons enter Canadian territory. The strong relationship between Canada and the United States must always consider political dynamics that face our respective countries, as these same political dynamics could have significant impact on moving border and interagency initiatives forward. A mutual respect and understanding of the political winds of both countries should be considered when any courses of action are taken, thus ensuring that there are no misconceptions or misunderstandings. The United States works hard to ensure that its border, immigration, and security policies are corrected, as does Canada work hard on these very same issues. Our nations have built our relationship on trust and mutual cooperation, and that should continue to be the case. As we work to constantly improve that sense of trust, that spirit of cooperation, and the practice of sharing information between nations, We must each work on similar relationships between our own departments, ministries, organizations, states, and provinces. We must constantly strive to eliminate the cultural and procedural barriers that exist within our own nations and across domestic departments. We must consider ways to collect vital information that impacts our respective homeland security, yet protects methods and sources. We must learn to integrate intelligence and law enforcement information, yet protect the individual rights of our citizenry. While the focus of today's homeland security has brought the threat closer to home, we must remember that the environment is not only intelligence-centric, but it is rule of law-centric as well. In the 21st century, where transnational crime and terrorism pose substantial and increasing threat and risks, it is worrisome for both our countries that the growing nexus between criminality and terrorism force multiplies the threats we face today. We require a better understanding of today's and tomorrow's challenges in order to best address them. And we must move away from our past definition of those challenges. We must address the challenges in context as they are today and will be tomorrow, not as they were yesterday. For it is proactivity that shall determine our collective future successes or failures. Your country, much like my own, was built on sound immigration policy, and ensuring these policies remain sound and go forward will be a determining factor in the positive growth of both of our great nations. In closing, both the United States and Canada have talented security intelligence professionals to perform the work that lies ahead. These people exist both within and outside of the government, and it should be a priority of government to engage these professionals and use to the fullest capability the sound knowledge and practical solutions they offer to the security problems our nations face together. We must ensure the right personnel are in the right positions. This human capacity, supported by sound and safeguarded intelligence, operating collaboratively between domestic agencies and international partners, will ensure that the legitimate traveler and the legitimate refugee are properly admitted to our countries, thus enjoying all the wonderful opportunities your country and mine has to offer. Thank you very much.
For your presentation. And now we will go over to Deputy Opitz.
Thank you, Madam Chair. Welcome back, Admiral. Welcome back, Mr. Platsis. Good to see you again, both. Admiral, from your former job as Deputy Director, you also mentioned about the intelligence gathering capabilities of what you were doing, which obviously impacts not only in terms of military situations and the overall security of a nation, but it also impacts, of course, on migratory patterns of human beings, whether it's immigration, whether it's just travel and movement back and forth. So, and you've discussed at length in your opening the value of intelligence. Can you describe, sir, how some of that, and the previous speaker talked about human intelligence in particular, and how some of that is gathered from that specific point of view, human intelligence, how it interacts with because you also said human intelligence and intelligence generally has to interact with the machinery, literally machinery of biometrics, to be able to give you the whole intelligence picture, so you know who's coming and going. Can you comment on that, sir?
Sure, I'm very happy to comment. One of the things that we both have to deal with as nations is trying to describe and identify today's problems and our future problems and challenges in yesterday's terms. All right? So when I say intelligence, we all immediately conjure thoughts of 007, Cold War definitions, military intelligence. In our IRTPA of 2004, the Intelligence Reform and Terrorist Prevention Act, I will quote on that law, that's our own, we go to great lengths to use the word information. And so this is where the two areas start getting very gray, and we have to be very cautious in the United States, as I would suspect as do you, as to what is information, what is intelligence, what is of military intelligence, what is of national security intelligence, what is of law enforcement intelligence. And these areas get gray. And we have to learn to understand how to collect that information, whether it be from what we call open sources, or from clandestine sources, or from international sources, or from specific activities, and piece that information together, yet absolutely respect the rights of our citizens, because the last thing we want to have are non-law enforcement government agencies collecting intelligence on individual citizens. We are constantly very cautious of that. That would violate our Constitution, that violates the ideals and the beliefs we have as a nation. But that doesn't make the challenge any easier. And so we have to make sure there is a sharing of information. And there has to be a hands-off at some period. There has to be a turnover to those that are duly vested with responsibility for law enforcement that can gather that type of intelligence, information, whatever you choose to call it. So one of the things we have to realize is we just cannot stereotype terms and apply them across the board. We have to be very cautious of how we use those terms.
How does now the information, say it's from a law enforcement point of view, combine now with biometric technology to create a picture for, say, a CBSA agent at the border?
Well, you know, I also, and I listened to your former panelist's comment. I do not want to, I'm not a biometrics expert by any means, okay, but I do want to distance myself a bit from the use of biometrics to gather intelligence and to conduct profiling, okay? I'm a nuts and bolts kind of guy. Biometrics is using the technology we have at hand to ensure you can prove who you say you are. We evolved throughout history. We had letters of mark. We had credentials. Then we invented photography. We were able to put your photographic image. We had to deal with cultures that thought putting your photographic image captured your spirit, yet we work through those sort of things, okay? And as the technology changes, I just want to be able to ensure that when you use that government ID card and put it into your computer, that if you take your index finger and then put it on the reader, that I can prove that the fingerprint identification of the person using the card that has the information is confirmed, and you are who you say you are, and you just did not come by that card. So I'm very cautious to stay away from biometrics as intelligence gathering and type of things. It's purely in identification.
Thank you, Admiral. Mr. Platsis, now in terms of interoperability of sharing information between whether it's between our nations, with the United States and ourselves, the UK, Britain, and others, and even just within our own departments here. What would you comment on? Because you talked about the interoperability of these departments and Shared Services Canada trying to basically integrate and aggregate a lot of that information. Can you comment on that?
Sure. Thank you. My concern when you conglomerate all different types of information is, as I mentioned, you have differing levels of security protocol. And I gave the one example there of just one issue of admissibility crosses a whole level of different departments, and all these departments have differing levels of security on what they use on their internal protocols. Yes, Shared Service Canada does want to do a streamline. But again, it's protecting the integrity, the confidentiality and availability of that information. So, for example, if CIC or CBSA has information on some person and then they need to verify it with, say, CSIS or RCMP or somewhere, at some point along that line, it may be possible, maybe not, that the information goes from something that's unclassified to a person of interest. And at what point do we ensure that that information hasn't been contaminated, that hasn't been altered at all? From a biometric standpoint, for example, it's, yes, we can get a retina scan, yes, we can get a fingerprint, we could do all this, but when we actually have our electronic document, are we sure that this information has been safeguarded in a particular way? I noticed from the previous session you pulled out your Nexus card. I have a Nexus card as well. And for anyone that has a Nexus card, you'll see you actually get this little sleeve that you are supposed to keep your Nexus card in because of technology that's actually embedded inside the card. It's NFC, Near Field Communications. Lots of the passports are actually starting to do this right now with the passports. Louder? Oh, that's it? Oh,
You finish
just
off your
finish off his
sentence.
thought?
Yeah.
Yeah.
Okay.
Finish off your sentence.
I just want to say that we need to ensure that that information is also protected, because there have been cases that even electronic documents can be forged and can be manipulated.
Thank you very much. I'm now going to go over to Deputy Freeman.
Thank you, Chair. Now, I'm new to this committee, but I understand that
Welcome.
both of you have presented to this committee before, Mr. Platsis, sorry about that, on this specific study. So I went to the evidence of March 15th when you were here and pulled out some questions I had just from looking at your testimony. You mentioned that the Auditor General had made numerous recommendations with regards to the improvements of the integrity and security of our immigration system. It revealed that officers have no idea who should be coming to Canada, as they do not have enough specific data to make an assessment on admissibility. Additionally, there is a lack of performance reviews, guidance, and training. So while biometrics may assist with the information collection, if these recommendations by the Auditor General are not addressed, officers still may not be administering the current laws accordingly with little oversight. So you stated on March 15th that quote, the situation becomes even more daunting because of inadequate ongoing training and over-reliance on technology, which risks both increased danger and complacent behavior, end quote. So what human resource improvements should accompany the implementation of biometrics if there were to be future legislative changes doing so?
I think you mentioned in there, to use a departure point, that biometrics should not be used as a collection point. It's to echo the Admiral's thoughts. It's more of a verification process. We need to know more about people before they actually show up to our borders. There's been a lot of chat right now about HUMINT. And HUMINT is not necessarily, again, to quote the Admiral, the James Bond type situation. Human intelligence can range as something as simply as community engagement. For example, Canada has the most multicultural community in the world. We have everybody from every side here. We need to get some more community engagement, because if you actually think of it, global security is a function of local security. So how can we help verify this information about people coming in? Engage these communities that we have. For example, the Greater Toronto area, I'm sure you could find pretty much anybody from anywhere that you want. This is human intelligence that is being built up to create information, not necessarily only about a person, but, for example, a particular region, because these people call back home, they have relatives there, they have family there. It's all these little pieces of data that start coming together that we have a better understanding, if not necessarily a particular person, but the context of a particular part of the world.
I actually find that very interesting. What could you recommend concretely for this government to do in order to engage those communities?
I think you could start at even local law enforcement. And I've seen and know of senior law enforcement officials who have been very active in engaging diverse communities, as opposed to waiting for these communities to come talk to us. We should be going to them and talking to them and saying, tell us a little bit about your part of the world.
That's interesting. Also, on another, well, sort of related topic, you did mention sort of accuracy of information that comes from, if I'm wrong, RCMP, CSIS, to CBSA, for instance, just a few minutes ago. And you also on March 15 mentioned that, quote, if the RCMP or CSIS has somebody on their watch list but they do not inform the CBSA, it is not the fault of the CBSA that they let the individual into the country. It is the fault of the system for not ensuring that necessary agencies can easily integrate and share their information, end quote. Better information sharing between departments was also recommended by the Auditor General. So I assume you agree with the recommendation itself, and how do you suggest that we could actually do better information sharing?
I think that, and you could say this of government and many other sectors, we suffer from institutional silos. There are both institutional barriers, there are cultural barriers. There's plenty of information that I think that you could find on this on numerous research studies that certain departments have traditionally not worked well together because there is a cultural base. To go back to almost the same idea from the previous response, it's dialogue. We need to start within your own institutional silo. You could probably handle your issue, but once we start crossing into different departments and into different spectrums, person A from organization A might not work that well with person B. So we need to actually start chipping down these silos and getting a more interagency response going on. Now, as a function of that, we are going to start sharing a whole lot more information between each other. And the more information that we share with each other, we create actually a larger database. And the larger database that we create is something that we need to safeguard because, like most databases, they become a target. They are a risk. So unless we start chipping down these institutional silos, which could be between departments, and I would even suggest internationally with some of our traditional allies, we need to talk a little bit more. And to take a quote from one of my other fields in disaster and emergency management, the time to exchange business cards is not when the disaster happens, it's before.
Yeah, I do have time. You've walked right into my next question, which is, so what kind of security provisions should we have for basically ensuring the safety and security of this information if we're going to be having much more information sharing, et cetera?
That's a long question. I'll try to give a short response. There's both the technological side and there's a human side to this. So, for example, you can have the absolute greatest technological solution, and if you have someone, say from this committee, walk into a computer with it and plug in a USB key with a piece of malicious code, you have just compromised the entire system. So we need, not only do we have to have this technological safeguard, because, and you could see this on numerous reports, and the most recent one would probably be the CSIS one that came out a few days ago last week, we are getting attacked daily. If you want me to give you some statistics on how malicious code, do you want statistics? Okay. There's probably into the internet, and again, you have to understand that these are estimates because not everything goes reported, and these are coming from places like McAfee and Google.
Thank you very much. Just if you could finish your sentence.
We are being attacked daily from a cyber threat. We need a technological solution, and we need a human solution.
Thank you.
Thank you.
Our next speaker is Deputy Lamoureux.
Thank you, Madam Chair. I guess maybe have both of you provide some comment. One of the big issues in which many Canadians, if not majority of Canadians have, is just the ability to be able to travel. And given that you're here, Admiral, what I want to focus in on is the United States. Whether it's cross-border shopping, commercialization, big trucks, visits, all sorts of reasons why we have Americans coming north and Canadians going south. And part of the concern is that when you look into the crystal ball and you say, well, what is it going to take in order to board the plane? But for now, we'll talk about the cars crossing the border. What do you see what do you believe is necessary in order for us to be able to try to allow for that flow to maintain at a reasonable time span? Is there something specific that government could be doing that maybe it's not doing? Like, is there enough interaction between the U.S. home security and the Canadian security services? And I guess, given this will probably be my only question, because there is only 5 minutes, and both you'll respond to it, if you also want to touch base on the airports, that would also be beneficial. Thank you.
Just a point of clarification, are we talking Canadian and U.S. citizens only, or are we talking writ large?
Citizens of both countries exchanging across. Let's just assume that they're all doing it in goodwill and no real threat. But what kind of process do we see?
And that's an absolutely great question, and it's a question that I think gets to the very heart of how our two nations need to address a continental, if not a regional, two-thirds of a continent problem, challenge. And it's, yes, we've made tremendous progress over the years, certainly since 9/11, in cooperation, information sharing. ITAC and NCTC both worked very closely, but you're exactly right. This is that complicated interaction between terrorist information, intelligence, law enforcement information, and relationships between our largest trading partner. How do we make that all work? I would suggest to you, I'm going to be a little bit cynical here, and probably predicated on only marginal amount of fact, but I wouldn't be surprised if we were to say our processes, while evolving, are all predicated on how we protected against rum runners coming across the border during Prohibition, okay? I'm not sure I want to spend a lot of time on bona fide commercial traffic going across the border, so I'm with you. For the legitimate traveler, business person, we need to work to solve those relationships. The problem is we have to have absolute transparency and understanding and the ability to control our borders from the exterior. I would venture to say the typical resident of Ottawa and the typical resident of Washington, D.C. are not the threat coming across the border. And so what we have to do is we have to make sure that we have the right application of technology and processes that allow us to verify that that truck coming from DuPont into Canada contains the materials that are on the bill of lading, and it's driven by a driver that has correct identification, and whatever we can do to make that easy, whether it be RFI technology, biometric technology, as well as sound protected processes within our individual nations. I personally believe we should work to the best of our ability to eliminate as many of the controls across the northern border of my country, the southern of yours, as possible. But that means we have to get a number of other things right first, because I'm not worried about the typical inhabitant of Ottawa. I'm worried about people that come up illegally through my country, either to gain access to my country, potentially to gain access to your country, or people coming in from the north or from other points of entry into your country and then trying to come across an unprotected border to the north of mine. So we have to make sure that we have the processes, the correct interaction between agencies. And again, this gets back to intelligence always took place in another part of the world, okay? Well, now it's law enforcement. I would venture to say, and
if you could finish off your thought,
in my
please.
country, we're had been much better prepared to do foreign intelligence than we were when the threat came to our own shores.
That's a good point.
Thank you very much. Thank you very much. And the next speaker, actually we've got two for the price of one. It is Deputy Weston and Menegakis. They're going to be sharing their time slot.
Merci, Madame Présidente. Combien de temps est-ce qu'il y a?
Thank you, Madam Chair. How much time do I have?
Both. Nice to see you back again. And I'll put in a little plug for Mr. Platsis, given that you're at my alma mater, Osgoode Hall. I wish you well there. It's rare that you get someone who's so involved in both teaching and studying at the same time. I don't know how you do it all. I'm glad you were both here to hear the other witnesses, because I listened very closely to what they had to say. I was listening to hear their criticisms of biometrics, and it seemed to me that the most trenchant criticism they had is that it's not perfect. In fact, one of the last comments from Mr. Mueller was these are not infallible technologies. Early on in your testimony, I think it was you, Mr. Platsis, you said that these technologies should be a tool, not a crutch. Can I just ask you to address the concerns that were raised in the first hour? Should we be throwing out biometrics because they're not perfect? Should we be saying that because there are false matches sometimes, therefore the biometrics should not be used? And maybe if you could each spend a couple minutes on that.
You want me to take the first one? Okay. No technology will be perfect, and I think that's something that the committee should understand, not only for this committee, but any study. Any technology is simply a function of time before it breaks down. Any secure system. It could be a matter of seconds, it could be a matter of years, depending on the security infrastructure that's there. Will mistakes happen? Yes. Mistakes do happen. Of course, not going to name names. To give an example where a Nexus card holder, someone who has been processed by both countries, has been vetted by both countries, somehow, randomly, somewhat frequently, still manages to get 4 S's on their boarding pass when leaving from a certain airport and not going to a particular other state. And the 4 S's, for people who don't know, it's a secondary security threat. That's a little bit of the problem when you rely solely on the technology to be doing this. I do not think that tossing away the benefits or the technology writ large of biometrics would be the best of ideas. It's an evolution of how we do identity, and I think the Admiral explained that quite well, that we went from tombstone data to photographs to fingerprints to I think the information needs to be secured with the understanding that it will not be perfect. So if we're going to invest in these sort of systems, be it from information sharing between departments or biometrics, we have an inherent responsibility also to safeguard the systems, the databases, the infrastructure that they are predicated on. And again, any sort of database, and this is a great example, this becomes a target for others. So we have a responsibility as we're collecting personal information that while we do use it to verify and making sure that the right people are coming here, we need to protect it. And just my last point before I pass it over to the Admiral, starting a biometric file on someone or starting a file at all on someone when they just show up to our border, that doesn't really do much. It's we need to know more about the person before they actually come to us. Because I could just show up, for example, to the United States and give a fingerprint scan. And if there's nothing to talk about George Platsis or this fingerprint or this retina, the
Right.
file starts there.
So no one's.
You have about 3 minutes left now. Is it okay?
So no one's saying this should be done in isolation, and you both made the point very well that it should be done with human intelligence as well. And given the nexus that you like to, that where you like to use, Admiral, between Canada and the United States, and how together we're more able to protect against terrorism than if we try and do this in silos, then how would you put biometrics as part of that nexus? And please, maybe we'll leave a minute or two for my colleague.
I'll do my best. When I was growing up, my father refused to buy a color TV until they perfected it. Okay? It's not about the technology. Who cares about the technology? And Moore's Law tells us that the technology is going to change in 2 years anyway. Okay? It's about what is it we're trying to do with the technology. What is the application? What are the processes that we want to employ? Why would I ever, no offense, okay, why would I ever want to start a biometric file on anyone? Okay? I'm not sure what good that does. And again, I'm not an expert. But I do know that each of our governments have some sort of certification and documentation of who we're supposed to be, and we're just moving forward so that somehow, in today's state-of-the-art technology, real easy for me to put my photograph on somebody else's passport. So now I want to take advantage of the state-of-the-art technology that exists, so to sit there and say, oh, that is my fingerprint. That is my iris or retinal scan. When you get into law enforcement, then we have uses for DNA samples. But now that gets very touchy because that's intrusive. That requires giving a sample, and it gets complicated. But that's law enforcement. So you need to know what you want to do with the technology, and that's the critical factor, I believe.
So once you want to keep out terrorists, you would say, and you were just pointing to your passport, and you were showing it up to the committee, that would be a useful device among other tools to help us protect ourselves from the terrorists.
I believe so.
Costa?
I think we're done, are we not? 30 seconds? Well, let me just use my 30 seconds by thanking you for coming here. Well, once again, it's always a pleasure to have you with us. This is a study on security we're doing, so this information in your testimony is very useful to us. Our goal, of course, is to ensure the safety of Canadian citizens. Before we allow someone into the country, we want to identify who they are. And any tool that we can use to help us in that identification process better protects Canadian society. And quite often, people come here with no documentation. And I'm sure you've had those experiences. So I've only had the 30 seconds. Let me just say a big thank you once again before it goes on to the next member here. Thank you.
Mr. Charquette, you have 5 minutes.
Thank you, Mr. Chairman. Thank you to the witnesses that appeared before us today. This is a fascinating subject, and it's very important, I believe, to discuss the issue of border security. But I'd also like to mention that in my riding in Drummondville, there are many people of immigrant backgrounds that come to see me and raise another important issue, the issue of better access to the labor market and better options for integrating a Canadian society. I certainly hope your committee will be studying these important issues because these are urgent matters as well. As to the subject today, Mr. Platsis, in past testimony before this committee, you said that the use of biometric information is only useful if it was cross-checked based on a list, database, and a number of witnesses have raised the various concerns about security lists and the no-fly lists, whether they be internal, domestic, or international, in terms of, for instance, faulty information or the difficulty in amending anything on the list when there is a mistake on the list. Is this a concern to you, and do you have any potential solutions to it?
Thank you. Yes, on the comment of faulty information, and I think I somewhat touched on this my opening statement, is we need to be able to have some sort of mechanism, and it may be outside the bounds of this study, that we can verify our information. I think in anything in life it will be not prudent just to take one source and assume that should be the source. It's you have crossing vectors and nexuses that create a more sound picture. This comes back to the sound information. Again, this may be outside of the view of this own particular study, but reviewing things, for example, how the RCMP can manage things under the Security Offenses Act because they are the lead agency for national security, or how CSIS under sections 12 through 17, might be 18, how they collect information, what they do. It goes back to, I think, when I was talking to Ms. Freeman, that we need to break down these institutional silos. So we can't rely just on one picture. We can't rely just on the one statement. And as our membership in the Five Eyes, we need to be able to do something from a Canadian perspective that allows us to further this information sharing, because otherwise, and I say this respectfully of my colleague, which I admire very much, it's every other country has their own interests, as Canada has its own interests. So unless we can take this from a Canadian vantage point, we risk being handed information that is not necessarily in our own best interest. It may be. You know, you'd like to believe that your partners and allies are looking out for you. But at the end of the day, everyone is going to be looking for their own interests. I'll only comment on a very quick case, for example, that is an open source, even though it wasn't detailed. It came out of the UK, where the U.S. was afraid to share information of a Mumbai-style attack happening inside the UK for fear that their own U.S. interest sources may have been compromised in the process. So we have our departmental institutional silos, and then we have our international silos. We need to be more comfortable working together, keeping in mind that if we want the best decisions for Canada, they need to be taken from a Canadian vantage point, a Canadian verification, a Canadian insurance.
45 seconds.
45 seconds? Well, then quickly, I would ask this. You're referring to a danger of perhaps having certain information, importance of individuality, and the sacrificing of our personal freedoms. I think the other thing that's important is to remember that even if we go with biometrics, we need to make sure there's good transparency so as not to violate rights and people's privacy. I think you've already mentioned this. You said it was important to ensure that all of that information does not harm, is what I'd probably say, does not harm individuals' privacy, and in that sense we would need to find ways in which to ensure transparency. I just let Mr. Platsis respond to that. Thank you.
Well, actually, we don't have any time. We'll have to go to Ms. James, and Ms. James can determine whether or not she wants to repeat the question.
Thank you, Mr. Chair, and thank you both for being here, and I cannot tell you how refreshing it is to have witnesses actually speak to the purpose of this study, and the questions that we're discussing in this last hour are all relative to this study. So I really appreciate both of you being here and waking me up somewhat. I'm going to ask a question just straight out. Does the United States collect biometrics on all of its citizens?
Absolutely not. Okay. Now, there are certain categories, like military DNA is collected, okay?
But biometrics, there's not a file in every United American.
Absolutely not. Absolutely not.
That's good to know. I'm not planning to, move there anytime soon, but I will let you know that neither will Canada. Canada, the purpose of our biometrics that we are moving to is actually for foreign nationals only. So, and as you've stated, there's no use collecting biometrics unless there's a real purpose for it. And the purpose that we are implementing is so that who applies is who arrives, and we can verify that at both ends. But I'm going to ask a question because you did talk about, you held up, a fake passport, and you said you can change the picture very easily. How easy can someone change their fingerprint? I'm just questioning this because I've heard in other sessions where someone might have said that biometrics is not foolproof, and it's easy to, change your facial structure, and it's easy to change your fingerprints. Is it easier than changing a document, such as taking another person's photo and putting it on another person's passport?
I'm not an expert in this. I'm going to give you an opinion, okay, personal opinion. I would venture to say it's probably not as easy as motion pictures might make it out to be, but I would venture to say that it perhaps is possible, and I'd venture to say in 2012 it's probably more possible than it was in 1950, and in 2020 it may very well be easier than it is in 2012. And that's why we go through, in the United States, is it thumbprint, index finger, 5-print, 10-print, and we constantly evolve.
I was waiting for that word because it certainly sounds like an evolution of technology.
But in the same vein, if I'm going to ask you if you really want to circumvent the system, then I'm going to ask for 10 prints, and I'm going to take a retinal scan as well, and then hopefully as perfected, I'm going to do cheekbone measurement as well. And you're really going to have to go to some effort to change all of those things.
We had a couple of witnesses mention the infamous Richard Reed, the shoe bomber, and they talked about the problem with profiling, and apparently this person fit every profile that should have raised all the bells and whistles, and in fact it did, but he was still allowed to board a plane. Now that we know who he is, and if he had provided biometrics at some point after he was arrested and charged and convicted, would he be able to easily walk into your country if you are also using biometrics and he pops up in your database as being the shoe bomber?
Well, that gets back into the previous question. That would it be easy? I don't think so. Would it be infallible? Of course, it could be infallible.
At this point, we're going to adjourn the committee. The bells are ringing, and it's 5:30.
Thank you.
Thank you for the presentations to both presenters. Thank you.